inflammatory bowel conditions that can present with diarrhea, such as ulcerative colitis and Crohn's disease. Crohn's disease tends to have more constipation than diarrhea, but some people with Crohn's disease can also get diarrhea and abdominal pain. With ulcerative colitis, again, that's a debilitating condition that can present with bloody diarrhea, mucus, abdominal pain, abdominal cramps, bloating. With ulcerative colitis, when you do have flare-ups, you can find yourself going at least 10 to 20 times a day, quite bloody mucus. You just need to practically just sit in the toilet, because anytime you leave the toilet, you're going back again. Again, these are conditions that are diagnosed, through what we call, the gold standard is a colonoscopy, which is a camera that's inserted through the back passage. Before that, your doctor might want to do a stool test called a fecal calprotectin test. Now, a fecal calprotectin test is quite sensitive for inflammatory bowel conditions. So if you're over a certain value, usually over 75, or your values are in the hundreds, 200s, 300s, in severe cases, even in the thousands, then your doctor might want to proceed to you having a colonoscopy, which then diagnoses ulcerative colitis or Crohn's disease. Now, these are conditions that, good news, can be managed, with steroid treatments to reduce the flare-ups. And nowadays, we now have biologics, where basically you're taking medications in the form of injections or infusions, which you can now do by yourself at home. They're usually maybe taken every 2 weeks. And when you're stable, then they're taken less frequently, whether it's every 6 weeks or every 8 weeks, depending on the type of treatment that's used. While you're on this sort of treatment, your doctor would also want to monitor you for response, side effects, as well as blood tests to make sure that you're responding to the treatment. And if hopefully you do eventually go into remission, then you might even come off the medication, or you might be on this medication for a while just to have that stability. With these sort of inflammatory bowel conditions, such as your colitis and your Crohn's, there tends to be flare-ups. So, for example, smokers, are more likely to have Crohn's. With ulcerative colitis, even taking anti-inflammatory medications such as ibuprofen can trigger ulcerative colitis. Stress can be another trigger for ulcerative colitis. So again, just knowing what your triggers are for your inflammatory bowel conditions will help you to manage your condition properly.